So let's have a digital health certificate acknowledged by WHO if you have been vaccinated or tested properly, then you can move around. So for the next pandemic, instead of stopping the movement of the people 100%, which clogged the economy globally, you can still provide some movement of the people. Indonesia has achieved, G20 country has agreed to have this digital certificate using WHO standard. So hopefully for the next pandemic, we can still see some movement of the people, some movement of the goods, and movement of the economy.
The COVID-19 pandemic highlighted the value of digital health solutions in facilitating access to health services. While the emergency phase of the COVID-19 pandemic is now over, investments in digital infrastructure remain an important resource for health systems and for economies and societies at large. Like many countries, the European Union made significant investments in COVID-19 certificates to help people move around as safely as possible during the pandemic. The European Union's certification system was used by all 27 EU member states and more than 50 other countries. Building on the success of the EU system, WHO is proud today to launch the Global Digital Health Certification Network. So thank you so much to European Union for the excellent certification system that you have transferred to us, and we have the chance to build on it. WHO will begin operations of the network today with the existing COVID-19 certificate as a global public good. Soon after, we will expand this infrastructure by incorporating other use, such as a digitized international certificate of vaccination, routine immunization cards, and international patient summaries. WHO will continue to work with all regions to ensure that the network is accessible globally, incorporating relevant experiences and standards from other countries and regions. It's important to emphasize that privacy is key. WHO will not have any access to any personal health data. We will only maintain a directory of the public keys that can be used to verify the authenticity of a member state's digital health records. The Global Digital Health Certification Network will be an important part of our efforts to strengthen health systems and support our member states to prepare better for the next epidemic or pandemic. The network could also play a crucial role in cross-border humanitarian situations by ensuring people have access to their health records and credentials as they move across borders due to conflict, the climate crisis, and other emergencies.
The pioneering digital partnership we are launching today is the opening of a new chapter in our partnership. The WHO is a cornerstone of the global health architecture and an indispensable ally for our European Health Union. For the European Health Union, today is also an important day for our contribution to global health. A central pillar for the EU's COVID response is the EU Digital COVID Certificate, which is now being scaled up to global level. This was developed in record time, in the most difficult period of the pandemic. This unique open source system, built on the power of science to get our economies and our societies moving again. It showed our citizens the light at the end of the tunnel and protected at the same time public health amid the uncertainty of the pandemic. And this EU success story quickly became a global standard. We worked hard with all our international partners to ensure that their national certificates could be recognized under the EU COVID certificate framework. Today, the framework has already been taken up by almost 80 countries. It is truly an example of what we can achieve when the world comes together. And I'm delighted that as of July 1st, the World Health Organization will take up the framework of the EU Digital COVID Certificate. Although COVID-19 is no longer a public health emergency of international concern, this new system will remain a key part of our global preparedness to face future health threats. And through this system, we will build a genuine world standard in digital health documentation. Its global successor, the WHO Global Digital Health Certification Network, is the new chapter in the development of digital health. And as the pandemic has shown us all very clearly, digital health does have the ability to transform healthcare systems around the world and deliver better healthcare to citizens. To end, allow me just to say a few words on our cooperation with WHO in advancing global health more generally. I have said many times that a strong, accountable and well-resourced WHO must be the leading authority in a reinforced global health architecture. The EU will continue to play its part towards the central objective in the negotiations for an international pandemic agreement and the amendments to the international health regulations. I believe that, as in other occasions, during these last very difficult 3.5 years, the WHO and the EU have come out stronger, have come out more determined, and we have come out more united to improve global health.
Arise, O Lord, disappoint him, cast him down. Deliver my soul from the wicked, which is thy sword.
Yea, the light of the wicked shall be put out, and the spark of his fire shall not shine. The light shall be dark in his tabernacle, and his candle shall be put out with him. That the wicked is reserved to the day of destruction, they shall be brought forth to the day of wrath. Who shall declare his way to his face, and who shall repay him what he hath done? Yet shall he be brought to the grave, and shall remain in the tomb.
The Lord is known by the judgment which he executeth. The wicked is snared in the work of his own hands. Higgaion, Selah. The wicked in his pride doth persecute the poor. Let them be taken in the devices that they have imagined. For the wicked boasteth of his heart's desire, and blesseth the covetous, whom the Lord abhorreth. The wicked through the pride of his countenance will not seek after God. God is not in all his thoughts. He lieth in wait secretly as a lion in his den. He lieth in wait to catch the poor. He doth catch the poor when he draweth him into his net. He croucheth and humbleth himself, that the poor may fall by his strong ones. He hath said in his heart, God hath forgotten. He hideth his face, he will never see it.